guys, myself Prakash. Today in this video we are going to see about gluteal region, that is our butt, and we are going to see about the gluteal region, the muscles present in it, the insertion, the origin and the actions, and also the exercises or to strengthen the muscles we are going to see in this video. So we are going to see about the gluteal region. So the gluteal region is the transitional area between the trunk and the lower extremity. The gluteal region includes the rounded posterior buttocks and the lateral placed hip region. Now let's see about the gluteal aponeurosis. This is attached to the lateral border of the iliac crest superiorly and splits anteriorly to enclose tensor fasciae latae and posteriorly to enclose gluteus maximus. The yellow color highlighted in the picture is the gluteal aponeurosis. Now let us see the different layers in the gluteal region. So the first we are going to see about the superficial layer. So the superficial layers are gluteus maximus, tensor fasciae latae. So the yellow color highlighted in the picture is the gluteus. The second one is the intermediate layer. Those are gluteus medius, piriformis, superior gemellus, tendon of obturata internus, inferior gemellus, quadratus femoris, upper part of adductor magnus, and hamstrings. So the muscles which I read are highlighted. The third one is the deeper layer, that is gluteus minimus, reflected head of the rectus femoris, and tendinous insertion of obturata gluteus maximus, origin, insertion, inversion, and actions. So the origins are posterior end of the iliac crest, posterior surface of the sacrum, coccyx and sacrotuberosus ligament. The insertion part is iliotibial tract, that is 3/4, and the gluteal tuberosity, that is 1/4. And the inversion is inferior gluteal nerve, that is ventral rami of L5 and S1, S2. It emerges below the piriformis muscle to penetrate the deep surface of the gluteus maximus with accompanying. Now let's see the actions involved in gluteus maximus muscle. So extensor at hip joint during running and climbing upstairs. Chief anti-gravity muscle in the standing up from a seated position. Strong lateral rotation of the thigh. Its upper fibers are active in powerful abduction of the thigh. It is tensor of the fascia latae, and through the iliotibial tract it stabilizes the femur of the tibia when the extensor muscles of the knee are relaxed. Now let's see about the next one, that is tensor fasciae latae. That is a small muscle close to the anterior border of the gluteus medius at the dorsal surface of the ASIS. Origin is the outer lip of the iliac crest from ASIS to tubercle of iliac crest. So the insertion part is iliotibial tract. The inversion is superior gluteal nerve. The action is helps in the flexion and abduction of the thigh and maintains extension of knee joint. Now you can see a picture on my side, which is the gluteal part of our buttocks, and you can see the muscles, how it originates, and the way of muscle moves in our body. So the yellow color is the gluteus maximus, the green is gluteus medius, and the blue is gluteus minimus. Now let's move on to the next topic, that is gluteus medius. So it is covered partially by gluteus maximus, and the origin of gluteus medius is dorsal surface of the ilium between the anterior and posterior gluteal lines and from the gluteal aponeurosis. So the insertion part of gluteus medius is lateral surface of the greater pronator on an oblique area. Now let's move on to the gluteus minimus, that is covered completely by the gluteus medius. So the origin part of gluteus minimus is gluteal surface of the ilium between the anterior and inferior gluteal lines up to the margin of greater sciatic notch. The insertion part of gluteus minimus is lateral part of the anterior surface of the greater. Now let's see about the inversion of gluteus medius and minimus. So the superior gluteal nerve, that is L4, L5 and S1, that emerges above the piriformis muscle with accompanying vessels to penetrate the deep surface of the muscle. So the next part is the action. So abduction of the thigh and medial rotation. So preventing the unsupported side of pelvis from sagging downward during locomotion.